Again, my name is Dave Hondula, and we'll be hearing from Ryan Winkle, my colleague, here in just a few moments. And we'd like to talk about community participation in heat governance to finish up today's masterclass. And I think our presentation will really speak to the concerns Sarah raised around procedural equity as a part of the heat planning process. Who actually has the opportunity to participate in making decisions about how heat is managed in our communities? Here's a quote from my colleague Melissa Gordaro, who also helped make some of the slides for today's presentation. And I think this captures what we heard both from Lad and Sarah in a slightly different way, expressing the ambiguity and complexity around the current state of heat governance, particularly in the United States. Here in Phoenix, where we're located, the hottest large metropolitan area in the United States, we are seeing an evolution of the approach to manage heat from the municipal level. You're looking here at the most recent version of the city's organizational chart that was posted online in 2019. And if you look very closely where that red arrow is pointing, you can see that heat now appears on the formal organizational chart, although it's not a department. It's labeled, as you can see, as an initiative or project, but perhaps a positive step forward in filling in some of those gaps that Sarah mentioned in hearing about dedicated staff and personnel and resources related to heat. And I also noticed that the poll at the beginning of today's webinar, a very small fraction of participants recognized that there were formal staff dedicated to taking on heat in their jurisdictions. And I'm encouraged that we are seeing evolution of how heat is governed and managed at the municipal level, but I think we also need to recognize that there's a long uphill battle ahead. Some of you might be familiar with this paper that came out from Jeremy Hoffman and colleagues earlier this year that looked at how land surface temperatures across the United States varied as a function of historical zoning, historical land use codes. We don't have time to get into the details, but you can see here A, B, C, and D reflect different types of zoning, and land surface temperatures were much lower in one zoning type versus another, to suggest that there are historical legacy effects of decisions that municipal and other levels of government have made that have produced perhaps a non-ideal and inequitable landscape for heat at the moment. And to take a closer look at what this might look like on the ground, here's a picture from the city of Mesa in Arizona, which we'll be hearing more about in just a moment. And this is what the historical governance of heat has produced. Imagine walking this landscape on a 40 or 45 degrees C, 100 plus Fahrenheit afternoon. You can see there's very little opportunity for shade. And if you look closely and think about where shade or trees could be constructed or implemented, it's hard to find opportunities. We've simply not had heat as an explicit part of our planning process thus far, and it's going to be hard to reverse those historical effects, as we've heard about before. So to fill in some of those gaps, particularly with respect to procedural equity, there was a project launched a few years ago, funded by a local philanthropic health organization here in Arizona, led by the Nature Conservancy, that brought together many different organizations to try to write community-driven heat action plans. And we don't have time to talk about all of the details of the project, but to give a few very high-level notes, the overall approach to the project followed Jan Semenza's work on urban blight, published more than a decade ago now, that followed this iterative process, beginning with community engagement, going all the way through implementation of particular projects. Today, we're really going to talk about what that top right corner of the process looked like. How do we engage residents to talk about this topic? What does participation look like, and how is that done in a meaningful and authentic way? We ultimately had 3 workshops in 3 different neighborhoods in the greater Phoenix area, where we mapped assets, mapped hotspots, brought in professionals to think about how to realize some of the ideas that residents brought forward. And again, we'll hear a little bit more about that from Ryan in a few moments. We focused this work in 3 particular neighborhoods that were identified using a wide range of metrics, some of which you've heard about from Lad and Sarah already. Of course, there are many neighborhoods in our region and others where heat work is desperately needed because of high rates of illness, high rates of stress and anxiety, high temperatures. And we believe that we identified 3 of the neighborhoods where that work was was absolutely needed. The organizational structure for the project looked a little bit like this, where there was a core team of public health officials, researchers who got the project, put some initial ideas together, but very early in the project approached community-based organizations, which really turned out to be the anchoring institution for this project. And the community organizations were responsible for and led nearly all aspects of community engagement. And again, we'll hear more about that from Ryan in just a moment. Eventually, this resulted in interaction with hundreds of residents in the region, and then their ideas communicated to other community-based organizations, decision makers, and so on. There is a guide that has been produced, which is available online. We'll be sure to share it with all of you. And just to show you a couple of pictures from what's inside, you'll see some strategic themes for improving the situation with heat in the region. You'll see renderings of ideas that residents had that were then professionally regenerated. So here we're looking at that very hostile urban environment that we looked at before, with some cooling amenities added. There are also, for example, lists of organizations that could and should be involved in advocacy and implementation around heat solutions that were articulated by the residents. But I think what you're really eager to hear about is how this engagement piece worked, how we were working to fill in some gaps in procedural equity. And with that, it's my great pleasure to introduce the leader of one of our most dynamic and impactful community-based organizations, Ryan Winkle from Rail CDC. Ryan, thanks for joining us.
Hey, thank you very much. I will kind of go quick through this as well. So Rail, Retail Arts Innovation Livability, started as a group of just a couple individuals who cared in the downtown Mesa area during the time that light rail was being constructed, regarding how to make the place, more livable and more usable, more equitable for the businesses that existed there, as well as the neighborhoods attached to those businesses. So when we heard about this project and the Water Tower Improvement District, or the CARE neighborhood as we call it, we were really happy because the CARE neighborhood is located just outside of the downtown, just north and south of the downtown. North of it is the historically segregated African-American neighborhood called Washington Escobedo, and just south of it is called the CARE neighborhood. And we've done work in both of those areas, organizing and seeing how we can get those people to use and walk and bike and use pathways to get downtown. So this was very important to us. This neighborhood is traditionally a Latino neighborhood. It has many generations of Latinos, and it's one of the most dense neighborhoods in the area. Next slide, please. So this is a great question. Why would these people participate? As I went around and knocked on doors for days and days and days, people did ask, when I asked, hey, so what do you think about heat and the health problems that are associated with heat? And a lot of people said, hey, well, it's just something we've always dealt with. This is how it is when you work. We have to pay our rent, we work outside, this is how it is, so that to them, the idea of that they shouldn't be experiencing deaths and illnesses due to heat was not something that was in a possibility to them. And so the multiple touch points and asking questions outside of just heat or just our outcomes was important to build trust with the community so they could actually drive this project, because in this project, we didn't want to make it our project that we forced on them. We wanted to get what they knew and then deliver it to the city as their ownership of a project. Next slide, please. So what worked for us? From the very, very beginning, it was myself. I'm the chair of Rail, as well as other people in the group. We walked around, we asked questions, we collected stories. That was probably one of the greater pieces that helped us to gain their trust, was that we actually asked them their stories of their generations of living there and what they felt like the heat was over time, or their water usage was over time, or their experience in the streets, and their family's experience. And once they did that, they started saying, oh, maybe I will go to this meeting, since they seem to be worrying about what we're thinking about and how our lives are. And the 3 meetings was correct, but there was much more interactions than just 3 meetings. So we had a few different project groups, and the group that we chose that was directly located in the neighborhood is called the CARE Partnership, which is a group that has been doing health work with the neighborhood for a long time. So it was really easy for us to partner with them and use their connections, as well as the new ones that we were making. Go ahead, next slide. The context of this was difficult because when you're talking about heat and illnesses associated with heat, like I said before, this is not something on top of someone's mind. Their biggest thing is like, well, what if my air conditioner goes out? That's hot, you know, and who's going to give me the $3,000 to fix it? And if we said, hey, let's put some trees over here, it's a great idea. They said, okay, great. Well, who's going to take care of them, or who's paying for the water, or who's paying for whatever else that we're, you know, the thoughts are about this. There's really a big disconnect in the people in the neighborhood to the people at the city government, and what the interaction level is to say, what can I ask for, or what can I do myself? And so that the city really cares about a community-led effort that they can jump onto. And the people are like, what can the city do for me? So there's some level of connection between those. You can see here in this meeting here, we had a bunch of the neighborhood people come out, and then we had some city departments come out, and they were kind of shocked that they could just go and ask for something and they could just reply and say, yeah, let me write that down and we'll take that into consideration and give you a call back or reply back to you. Go ahead and next slide, please. This program was designed very well. It made it take longer than I think some other programs. We've done some other quote unquote outreach or engagement programs that don't include as much community participation or the responsibility of them owning or driving the conversation. So when we were kind of just an organizer to amplify their voice, there's been other good things that we've done that were not as successful because they didn't have someone driving the community voice, they just collected the community voice, if you can understand that difference. Go ahead and next slide, please. We did a really cool exercise too with the community, that we brought them in and we asked them, hey, in your experience of this neighborhood, where do you go and what do you do? And where do you find hot spots or pain points in your journey? And they knew them right away. This wasn't something they had to think about. This is like, oh yeah, I'm a mom. I live here with no car and I have 2 kids and I take this bus stop right here that takes 20 minutes to transfer to this other thing. And then I take the light rail over here, and then they can map out their whole hour-and-a-half painful, hot journey in the summer with 2 kids, which was, to us, that was like a gold mine of information. So we could say, hey, this is a great spot where we can maybe intervene here with this idea or propose this idea to the city. And the city was glad to hear it because they don't hear that kind of perspective. Go ahead and next slide. Here's another kind of maps of where cool spots and hot spots were, and some possible, things we could do. Go ahead, next slide. This is part of the CARE campus. Another thing that we had worked on is we worked with watershed management to give an example of what you could do by putting more trees in a watershed in one of the properties on the street that we're working in the kind of heart of the neighborhood. This is the health center. It was a lady who started it in the 70s. She moved in the neighborhood and said, hey, I just want to move somewhere where I can make a difference in a small way. I'm going to fight the gangs. And that was kind of her big thing. Then it became, oh, there's lots of kids here. I'm going to help them with their homework and do art projects and maybe get them basic health needs stuff. Then it now is like a full-on health clinic that also does Christmas programs, and it's a interwoven with the neighborhood. So for us to do a project with them and make their property better, being right in the neighborhood, it shows what other people can do around it. And if you've driven down there, I just drove down there recently, and I've started to see other people do things to the houses there, just to upgrade the properties and make them look nicer, add more trees, and so simple things. Go ahead, next slide. If you see right there, that's me walking around talking to people. There's also a very big language barrier. So I speak Spanish, but not the best. So, once again, it's a Latino family that's been there for generations. And then, the kind of white guy is coming in and talking to them about this heat thing and have you been feeling sick? And, what are my kids going to feel like in the future? Is it getting hotter? So they had definite questions as to who we were and to what we were doing there, just as how we had questions about them. And one of the things we had to do, I call this kind of like the trifecta, is you leave a certain amount of flyers, you collect emails, and you collect cell phone stuff. So then you can email and text, and then you usually then run ads on social media to that area, directed at social media, at phone numbers, emails, and then them and their friends. So then you end up hitting an area in 3 ways. In almost every way a person can actually see something or see some sort of media, you know. And you don't hit them with something that says, check out this large data collection on heat illnesses. You know, you hit them with something like, hey, have you noticed that your area has gotten hotter over your lifetime of living there? Because they can answer that question, you know. Next slide, please. So this is the same thing. Next slide, okay. Asset sharing. In this approach, we definitely came from the bottom one up and really tried hard to continue getting the same people back and same people back. That wasn't always easy because, once again, these people, their biggest thing is like, oh, I just got to go to work. That's what I care about, you know? And so we had to make sure and call them every time. I mean, there was a lot of different things, offer food, pick certain days that were better to get them there. But in the end, it did bring a good group that cared about the neighborhood and seemed to actually be invested there over a time period. Next slide, please. Let's see. Yes, everything that was gathered, even the stories we put up in the areas that they could find it. We dropped off literature with outcomes. There's a lot of stuff that we did to return stuff, and I think the CARE partnership, they just did a lot of remodeling and stuff, so I'll have to check again, but I'm pretty sure they have a copy of the heat action plan there, because it actually lives with the community. It's not ours to keep, it's the community's to keep. Okay, go ahead. Go ahead and come join with me on this one if you want. Because in this one, there's a lot of different things that happen, and just jumping on your things. A lot of these things that people really had an issue with is just the lack of drinking water on their journey, or the ability to be in a cool spot on their journey. There was even some stories of, hey, do you think that you could just put a sprinkler that went off a few times a day that we could just stand in? Something as simple as that. They really cared about that. And hey, you know, downtown, a block away, they have these wonderful shaded bus stops, but here we have like a stick in the ground that says bus. Is there anything that can happen around that? You know, very simple things like that is something that they really cared about. And it wasn't a big ask to the city, and the city is still being responsive to that. That's all that I have.
Thanks so much, Ryan. And again, there are many more details on this process. Hopefully you get a sense that Ryan has 1,000 different ideas about meaningful community engagement around this topic. And some of those are reflected in the publicly available document, including some of the lessons learned that are on the slide here. Just to wrap up, I know we're running short on time. I'll mention one final piece of the heat action planning guide is a rubric that was developed to evaluate community projects, and really all projects around heat. And this rubric spans 4 different categories, which you can see on the slide here. And it offers a numerical scoring system by which a self-evaluation could be conducted across dozens of different metrics related to any project for heat. Here's the first one. For example, the first objective might be to prioritize heat solutions that provide environmental benefits for under-resourced communities. And our hope is that whether it's someone in city government, a community-based organization, a researcher who's involved with the project, they could look at this rubric from the outset of the project and continue to revisit this rubric through on to think about where they are in this spectrum of impact, hopefully avoiding negative impacts like focusing on projects that allow negative impacts to occur, all the way toward ideally focusing on high impact projects that target under-resourced communities, that are responsive to community needs, and that create measurable improvements in health and well-being. It's been a real privilege to work with Ryan and the rest of the team on this project. There's a lot of continuing engagement and dialogue since the project came to a close more than a year ago, and really excited about what's to come, and we'd certainly be happy to answer any questions over email, social media, and a few in our remaining minutes together. Thank you.